So excited. We're here in Los Angeles with our 25th anniversary celebration and also our health equity tour, where we are gathered with some really fantastic partners and our promotores and community health workers. And we're addressing accessibility, affordability, and accountability. Early detection is key, and many of our Latino communities don't understand the importance of it. They're too busy raising families and working, so many hours. So we're here letting them know, take time out. We're here not only to do this for you, but at the same time, we're going to follow you.
We need these health equity fiestas is because we know in healthcare there are gaps in access. We know that to be completely healthy, we need not only a doctor's visit, but we need to be connected to the community, and we need to be connected to the resources that we need to help us in our day-to-day lives and in any chronic medical illness that we have. Instead of leaving it up to various reasons, we can make sure that everyone knows about the resources that are available to them. And how do we do that? We do that by engaging the community and then asking the right questions, and then using technology then to connect them to all of the resources that are available to them. Promotores play such a powerful role in healthcare is because they are the community. They are that in-person movement that is able to inspire people to live healthier lives, to go to their appointments, to come out to the health fair.
COVID was such a predominant health issue that many people let a lot of other, regular health checks kind of fall by the wayside. We know studies have shown that people are more likely to have trust in our community-based organizations than they are governments sometimes. And so it's important for organizations like Dia de la Mujer, the Latino Coalition Against COVID-19 to do that grassroots outreach and use those trusted community voices and those relationships to bring community in and let them know that this is a safe space. It is an honor to be here also, representing the work of my mother, Dolores Huerta, with the Dolores Huerta Foundation. Part of what we do is not only to, make sure that people have good wages and are, treated equally in the workplace, but also in their communities, that they're not impacted by the social determinants of health, which we know could be anything from, bad pollution to poor infrastructure on your streets.
I like to come to these events because we can outreach our communities. A lot of times when we work in our clinics or in our hospitals, in our venues, the people already know about where we're at. What about the people that don't know that there are resources for them? The people that don't know that we are here and that we can refer them to many community clinics. We want to be able to reach every community and every Latinx and minority community as well. So we want to be where the people are.
Okay, I'm really, really happy to be here because of what this event means. It's about saving lives, it's about early diagnosis, it's about a lot of screenings. We got a lot of folks that are partnering here, medical students, you got the nonprofit organizations, you got other families that are going to be coming to get that screening that they need. And whether it's blood pressure, whether it's cervical, whether it's breast cancer, just to get that screening, it could be life-saving.
It is very important that we build capacity. Women are the leaders of the home, the mothers. So when we can give information in Spanish and English about resources available for them, we're not only helping our own family, but we're helping the community.
DML is here to train community health workers and promotoras. First of all, our program is all about preparing for COVID aftershocks because we believe that there's other issues that are related to COVID. A lot of mental health, behavioral health issues that we need to address. Stigma is really high in our calls. We have a telehealth community navigation call center, and we're getting hundreds of calls, and it's all about what's going on with stress and stigma. So we are going to address those, and we're going to empower each of our community health workers and promotores to be available with all of the accessible information that they need to be able to provide evidence-based information. And they're going to be caring for a lot of people, and they love doing that because this is what they do. They're trusted members of our community. This is the fifth city. Now we're going to Puerto Rico in January, in Orlando in February, Miami in March, and the list goes on and on. So we're excited.